You're listening to the BBC World Service. I'm Julian Worricker with Weekend. With me throughout the programme, Orysia Lutsevich, head of the Ukraine Forum at Chatham House. That's the international affairs think tank based in London. And the British broadcaster and journalist Misha Glenny, rector of the Institute for Human Sciences, who's joining us from Vienna. Now, the next voice you're going to hear is that of Laura Delano, who has helped ignite a public conversation on psychiatric diagnoses and medication in the United States. Laura was a psychiatric patient for 14 years. She was diagnosed with bipolar disorder at the age of 14 and was prescribed 19 psychiatric medications, often in combinations of 3 or 4 at a time. She attended Harvard University and was a nationally ranked squash player, nevertheless, but later she became very ill and struggled to cope with life. In 2010, she walked away from the treatment altogether and for good. Well, Laura details that journey in a new memoir out this week entitled Unshrunk, a story of psychiatric treatment resistance. She's been telling me her story on the line from Hartford, Connecticut. A warning, you might find some of what she says distressing.
I was sent to my first therapist at 13, who soon sent me to my first psychiatrist at 14 because my intense anger and outbursts and irritability and the fact that I was cutting myself and overwhelmed by despair and talking about death had just overwhelmed all the people in my life. And, understandably, my parents didn't know what else to do. So there I was at age 14, sitting in front of my first psychiatrist, feeling totally lost and alone and misunderstood and not understood. And the psychiatrist at the end of this 1-hour session said, everything you've just described sounds like bipolar disorder. It's an incurable, lifelong condition, but not to worry. There are medications that I'll give you that will help. And to hear that message, to hear this message that basically my brain was broken and would be for the rest of my life, felt like a profound existential insult, you could say. I knew that my pain meant something. I knew that the world around me didn't make sense. The pressure I felt in school, all these expectations I felt on my shoulders, I knew they didn't make sense and that my emotions were a meaningful response to them. And so to be told I was the problem and I needed to be fixed with pills was devastating.
And at that point, what impact did the pills start to have?
Well, through high school, through the next 4 years, I tried not to take the pills regularly. I hid them, I threw them in the trash, I washed them down the sink, because when I took them, I felt possessed. I felt my body no longer felt mine. But when I eventually, at age 18, returned to a psychiatrist for help because I was still in so much pain at that point, I went back on the meds and I stayed on them. I don't think I realized it at the time, but those medications altered every single facet of who I was, physically, mentally, emotionally, cognitively, sexually, creatively, socially, all of it, really.
But during that time, correct me if I'm wrong, academically, in the world of sport, you were achieving, and significantly so, weren't you?
I was, and I think I happened to be one of those girls and young women who is good at school, so to speak. I could internalize information and memorize and regurgitate it. I could crank out papers when I needed to. I wouldn't say that I was actually really learning or cultivating a sense of intellectual curiosity. And I do think the medications played a part in that. And so, yes, I did well on paper, but I think at a deeper level, I wasn't evolving and growing into a critically minded, vital, engaged, curious young woman.
Let me turn the clock forward to the moment when you decided to walk away from the treatment altogether. What prompted that?
So this was many years later, 2010, and between that first year of college when I returned to psychiatry and that year that I decided to leave it behind, to summarize it, my life just had fallen progressively more apart. I had physical health conditions. I was getting more cognitively impaired, more emotionally dysregulated. I had many hospitalizations. I couldn't work. I couldn't take care of myself. I was dependent on my family. The way I like to put it is that I became a professional psychiatric patient. What happened was I had a few experiences with a side of the mental health system that I had never encountered before. I was forcibly hospitalized. I had the police called on me to do a so-called wellness check when I slept through a therapy appointment. And these encounters forced me up against a stark reality that I hadn't seen before, which was the system I'd been turning to for care was also a system of control. I just hadn't seen that because I had always said yes, and this was the first time I was saying no. And soon after that experience, I happened upon a book that looked at the long-term outcomes of psychiatric medications in the United States and made a strong case for the fact that if you actually look at what the evidence is telling us, on the whole, long-term use of psychiatric medications is making us collectively sicker. And that's when everything clicked.
Did you seek any medical advice specifically for that decision at that point?
I did. I went to my treatment team. I shared this information I'd learned. The message I got was, don't question these medications. You need them. And so I didn't feel supported by my doctors. And I understand that. This isn't something that they were trained to really engage with. And so I felt quite alone as I began the process of questioning my relationship to these medications and what I wanted to do about that.
And when you stopped, how quickly did you feel different?
When I decided to come off the medications, I did not know anything about how to taper them properly, nor did my doctors, because they hadn't been trained in this. So I came off 5 medications in about 6 months, which I would call cold turkey. I ended up having a really difficult time as I was coming off and for quite a while after I was off, not realizing that I was experiencing withdrawal symptoms. I was terrified. But as I educated myself and I learned about physical drug dependence, I realized, wait a minute, maybe all these challenges I'm having are actually the byproducts of coming off them too fast. And so I hung in there. And I would say that by 3 years off, I felt like I was actually alive.
Clearly, your story is an immensely powerful one, but it's not everybody's story who find themselves in your situation. And I wonder how conscious you are of that in the message that now naturally emerges from what you've said and written on this subject.
Certainly, my experience is not the experience of many people. Also, my experience is the experience of many people. And so I think it's important to make space for the vast spectrum of outcomes that people have with these medications.
But you're not necessarily saying do as I did, are you? That's the point I'm getting at.
Oh, goodness, of course not.
No.
Basically, the work I do is about sharing my own personal story and what I learned, sharing the broader story of American psychiatry and how it's changed over the past 100 years, looking at the drugs that were prescribed and what the evidence base actually shows us about them, and then just providing that information to people and letting them decide for themselves what's right for them, which may well be taking medications. And I totally respect and support anyone who says, you know what, my life has changed for the better because of these meds. I once wanted that to be true for me and maybe thought it would be one day, and it wasn't.
And why do you think we are in a situation where nearly 1 in 4 adults and nearly 6 million children currently take psychiatric medication in the United States?
I mean, I think there are many reasons why, and I wouldn't pretend to know them all, but what I know, especially those of us who were diagnosed as children, we are so bombarded in our culture with a medicalized framework of self-understanding where any kind of discomfort in mind, body, spirit, you're taught to see it as a problem to fix with treatment, with medical guidance. Sometimes that's a great path to take. But the moment I reduced what I was going through to a list of symptoms of an illness to be treated, I stripped what I was going through of any broader meaning and of any context of, what was actually happening in my life that was maybe playing a part in why I felt the way I felt. And I think as a society as a whole, we often do the same thing. And the mental health industry has really come to have a monopoly on defining what it means to be human and defining what is normal and abnormal. And so I don't believe that this is about the mental health system being bad or psychiatry being bad or anything like that. But I do think we need to expand the spaces that we have access to for both understanding these struggles and challenges and getting support for them. So, for example, the nonprofit that I founded in 2018, Inner Compass Initiative, we provide people with information and resources about all of this. But the thing that I get most excited about is we help people help each other, similar to an AA meeting. You know, if you're having a hard time in your life, sometimes, you know, the most helpful thing to do is to turn to someone who's been where you've been. Maybe you still see a therapist, maybe you still see a psychiatrist, but making space for other ways of getting support and making sense of what we go through, to me, is the way forward.
Laura Delano, author of Unshrunk, a story of psychiatric treatment resistance, published this week in the United States. Laura and her team at the non-profit she founded and mentioned there, the Inner Compass Initiative. They're not medical counselling or licensed professionals, as they readily acknowledge. If you're looking for support, here in the UK, the mental health charity Mind is available. The phone number for them is 0300 123 3393. And in the United States, Mental Health America is available on 800 273 8255. Just picking up some of the themes in that conversation, in recent years, mainstream psychiatry has begun to acknowledge the need for more support for patients getting off medication. Here in the UK, the Maudsley Prescribing Guidelines in Psychiatry, that's a respected clinical handbook, in July last year issued its first de-prescribing volume. We're joined live by its lead author, Mark Horowitz. He's an Australian doctor who now works here in the UK as a clinical research fellow in psychiatry in the British National Health Service, the NHS, and a lecturer in psychopharmacology at King's College London. Mark, welcome. Good morning.
Thanks very much.
A bit of context for us from what we've heard from Laura. She's not advocating no drugs ever. She made that abundantly clear. I wonder where you stand on the kinds of messages that are emerging from someone like her.
Look, I think Laura is an articulate messenger and representative of many millions of people who have been told that their problems in life, existential, identity, can be boiled down to a simple diagnosis caused by a chemical imbalance that can be cured by a drug. And, you know, it's not as simple as that. I think a lot of the drugs that are being given, as for Laura, suppress people's symptoms. They suppress or numb people's emotions. That can be useful for people in the short term. And in the long term, like for Laura, they can experience significant difficulties, cognitive impairment, fatigue, weight gain. And so there is a real question out there, for whom are these drugs more beneficial than harmful? And we don't have great answers to that because most of the studies done on psychiatric drugs are short-term, over a few weeks, whilst people are on them for decades, years or decades. And so Laura is, you know, a little bit the canary in the coal mine, saying that for some people, we don't know how big a group, these drugs could be doing more harm than benefit in the long term. And psychiatrists really need to pay attention to that because, you know, there's a lot of focus on starting drugs and very little focus on stopping them. And that is a huge, I think, hole in the profession.
I mean, I wanted to pick up on that point because I was struck by when she described the moment that she decided to stop and the process described as tapering, how little support either she had available to her or she felt able to call upon at that point. And if you are making a decision as life-changing as this, that's surely where the support, the medical support, the clinical support needs to be.
Yes, I think she's really highlighting there are a hole in medical education. You know, in medical school, in my psychiatry training, I was given hundreds of lectures on how to start these drugs and no lectures on how to stop them. It is not a focus of either research in the area, you know, much of which is paid for by drug companies. It's not a big part of medical education. So unfortunately, most doctors in this area are not well informed about how to stop their drugs. And that is why there is this cottage industry that's sprung up of people trying to teach other people how to come off the drugs. They're filling a vacuum that's been left by the profession, which I think we really need to pay more attention to.
Both my guests are listening very closely to both Laura and now you. I'm going to bring them in. They might want to ask you a question or make a comment or whatever. Arisia, what's on your mind as you hear both Laura and now Mark?
I think it's amazing that there's an effort to educate a patient. It's so important for people to understand how this impacts them. And no, we are facing a looming mental health crisis in Europe because of Ukraine, because of millions of children who are under the constant bomb shelling, the veterans, the families separated, refugees scattered across Europe. And I wanted to ask Dr. Horowitz, in terms of preparedness and any breakthrough knowledge in how we can treat post-traumatic stress disorders and other things. I mean, I've heard, for example, from U.S. SEAL veterans that the microdosing, that is now emerging through various psychedelic substances, they vouched for it. That was the only thing that elevated their symptoms and brought them to life. My worry is that where is the revolution in psychiatry?
Mark.
Right. Look, PTSD is an interesting area. The guidelines in the UK at the moment and other guidelines around, say that medications do not work well for PTSD. Medications are very good at suppressing or numbing emotions. And, what is helpful for people with trauma is being able to process those things in a safe place. There are various psychological therapies. Everyone always wants to find a quick fix, but with these sort of experiences, we know that drugs, like in Laura's case, can sometimes in the long term cause more harm than good. And so I think we really need to get back to basics and, the sort of support and relational interventions that we can help people with, rather than always looking for a new drug, although that's always popular in the field.
Misha Glennie.
Well, I remember in 2012, I was teaching at the Columbia University in New York, and I went for a doctor's checkup. I was in my mid-50s at the time, and the doctor said, "What medications are you on?" And I said, "I'm not on any medications." And he said, "What, you're in your mid-50s and you're not taking any drugs at all?" I said, "No. I think this is a problem which is particularly acute in the United States because of it's in the interest in a private medical system to push as many drugs as possible. And here in Europe and the United Kingdom, regulation stops some of the abuse of that." I'm glad that Laura Delano said that she is not recommending that people don't take drugs, period, and that it is appropriate for each individual patient, because there are times when unquestionably drugs dealing with psychiatric problems do help.
Yeah. And on that, Mark, are you finding within the British National Health Service where you're working that patients are increasingly coming to you asking for drugs, or almost self-diagnosing before they necessarily know whether that's the best course of action for them?
Yes. So actually the point made about America is actually unfortunately true in the UK and Europe as well. 1 in 4 people in the UK are on a psychiatric drug, similar in Europe. So America is not that far in front of Europe and the UK. And it's because there's been huge medicalization of human emotions over the last few decades. We've been taught that feeling despairing, feeling unsure, anxious, having trouble with concentration are medical illnesses for which there are medical treatments. And that has meant the threshold for who qualifies with a mental illness or should be given a medication has gone down and down. And so now by the age of 45, 86% of the public meets the criteria for a mental illness. So there is a very large proportion of the public that is falling into this category, and that is why medication is so widely prescribed. So I think we really need to rethink, where the threshold is and what counts as a mental illness and what is a normal part of life, because we have gone very far in one direction.
Mark, very good to have you on the programme. Thank you very much. Mark Horowitz,